Hello, my beautiful people. You're welcome to another episode of Nursing with Abby. Today, we are going to be talking about something very, very exciting and important. You're looking at me, you can see that I'm all pink. I'm celebrating with all women all over the world. October, which is our Breast Cancer Awareness Month. Yes, the pink month. Yes, and it's a way of raising awareness to women about breast cancer, how to prevent it, early detection, screening, and even commensurating with those who has lost a loved one or lost their lives to breast cancer, and how we can prevent the deaths and reduce it drastically. So that's what we want to do today. So I'm going to be taking you through what we can do about breast cancer, to prevent breast cancer, what are the risk factors, early detection, what does it do, and what are the treatments available. But before I go on, I'd like to thank all of my subscribers for always supporting me on this channel. I really appreciate your support. And I'd like to thank all my new invitees. Thank you so much. If this is the first time you're watching this channel, thank you so much for coming. My name is Abiodun, Nurse Abby. You can call me. I am a nurse, I'm a midwife, I'm a public health advocate, and I love what I do. I talk about nursing, I talk about lifestyle, and everything in between. So we are going to be talking about breast cancer as a subset of our Antenatal and Motherhood series. If you missed some of the series that I've taken about Antenatal and Motherhood, do well to check my previous videos, and you'd love the exposition of the knowledge that you get. Now, I would like you to like, share, and subscribe to your friends. It will help us so much to keep on churning out wonderful content on this video. And I'd love to see your comments. I really love to see your comments. Thank you so much. All right. Now, moving right into what we want to do today. Now, researchers have shown that 1 out of 8 women have a risk for breast cancer. That's a whole lot. That means if you have 8 women, 1 out of them have a risk for breast cancer, either because they are family, one of the members of their mother side family or maternal side family has breast cancer or died from breast cancer. So you see that it's a very big deal for us to make sure that we have a wide knowledge base about it. We can prevent it, we can detect it early, we can do the screening early, and then we can start treatment if detected. Because early detection saves lives. Now, even a study in Finland said that mortality amongst women of 50 years that were screened reduced about 22% to those women who are actually not screened, and they later discovered it when it is already a full-blown sickness or illness. So when you detect it early, there's a 22% chance higher of survival and being alive than when you don't detect it and it becomes something bigger than what the sciences can do about it. So it's important for us to make sure that we always check our breast to discover any slight deviation from normal and immediately report to our healthcare provider for further analysis. Okay? Now, breast cancer is so common because after skin cancer, it's also the most common form of cancer in the world. And what are the risk factors? Risk factors means that those that are prone to it. When you are above 50, you could be prone to it. Being a woman, you're prone to it. Though there's some cases of men having breast cancer, but it's not so pronounced. Now, you can also have a genetic disposition, like I said, when you have what we call BRCA1 or BRCA2. That's a kind of gene that the doctors will check for maybe when any member of your family had breast cancer or died from breast cancer. Maybe grandparents, aunties, and nieces and all that. Anybody in the family had breast cancer. Now, also, we noticed that sometimes you would ask people, what could we do to reduce breast cancer? What do we do to reduce? If I have maybe I have a family who had a form of cancer, and I'm trying to see, okay, how can I modify my lifestyle to ensure that I don't have breast cancer? Now, it's important that you moderate your lifestyle. Healthy weights, no alcohol. Then you discuss the risk with your doctor if you're taking hormonal contraceptives, especially if you have somebody who had died or has breast cancer in your family. So it's important for you to discuss with the doctor and let him see methods of family planning that might not be hormonal in nature, because there's a connection between the risk of hormonal contraceptives to breast cancer. Also, you need to breastfeed. Researchers have shown that women who breastfed their babies very well, the risk of cancer reduces by almost half. So why not? It's your breast, it's your baby, so you should be able to make your baby enjoy that wonderful form of nutrition right from your chest. Now, we say something about SBE, and that is self breast examination. What is that? It's just a way of you physically checking your breast and detecting any early signs. Like I said, early detection saves lives. So what do? We can do this self-breast examination in 3 ways. We can do it in front of a mirror. We can do it on our bed with the pillow at the side, the back of the examining breast. If you're using the right breast, then your pillow should be at the back of your right side, like that. And then in the shower. So what do? We use the tip of our hands like this. Yes, this is the tip of our hands to check through our breast. And we can do it in a circular motion. That's round. Remember, we talked about the breast being a large balloon with a circle in the middle, a circle around a middle, and then a prominence at the middle, like the point. That's the nipple. So we have your breast, your areola, which is that pigmented area, and then you have your nipple. So you're gonna go round the breast in a circular motion gently. So what are we feeling for? I'm going to be telling you what we're going to be feeling for, but we're going to go first circular. Second, we're going to go in an X shape. And third, we're going to go up and down and up and down like that. So what are we feeling for? We're going to be looking at the breast first, examining the breast, making sure that both are almost the same in alignment. That's the shape, the size. There should be not be one bigger than the other. There should not be one discolor to the other, you understand, or pigmented more than the other. You also check your breast, also you check your nipple, also that your nipple is well pointed or prominent. So want to check for any dimpling. Dimpling is like my cheek, yeah, dimpling like that. There should be no dimpling on your breast. It should only be on your cheeks if you have one. So then you should also check the underarm, that's your armpit. Also check for any lumps. You could also check for any swelling on the part. Now I'm not talking about breast engorgement. Breast engorgement does occur to those who are just delivered of a baby and they're having issues with actually breastfeeding the baby. Their breast is large, is big, swollen with milk, and then it's not coming out, so the baby is not feeding enough. That's breast engorgement. That's not what I'm talking about. You're not breastfeeding, you don't have a baby, and your breast is one side is much larger than the other, then you need to see a doctor. Then breast or nipple pain. Yes, breast or nipple pain in any form. Then you should also check for any skin irritation, maybe at the lower side of your breast, at the underside, at the top, at the lateral side. Just check for any irritation. Then you should also check also for what we call orange-like breast. You know, the way a breast will just have some points or some dots on one side like that, maybe swollen, maybe nodular. Please make sure you check with your doctor. So what are the diagnoses for breast cancer? We actually advocate for mammography. Mammography is just a way of trying to check inside the breast to see for any lumps. Yes, it's just a machine mammogram which you put your breast on and then you try to check your breast under the machine. So we always advise that after you're 40, you do it annually. You do mammography annually. Then also ultrasonography, that's like a scan of your breast, can also be done, and also a biopsy. Maybe when they see something at the scan or the mammogram level, they can request for a biopsy. That means they're going to take a part of that lump that they see and they will check it with the histology department to check if it's cancerous. Then if it's cancerous, then there are other methods that they will use, such as sectoral resection. That means that they will pick that particular side and then they will remove that lump and then they will reserve this breast. Some can be radiation therapy, some can be chemotherapy, and some can be hormonal therapy. So we have various therapies for the management or treatment of breast cancer, but it is important for us to detect early because the breast is a fatty tissue. So if there's any lump that is undetected, it is possible that the lump migrates or moves from where it is and affect other structures even without any signs and symptoms. So you see that early detection is very important. So I hope I've been able to give you a brief information about breast cancer awareness this month. Please share the word to everyone. It is important that we mothers, we are the workforce, we are the heartbeat of the home, and we need to be alive to take care of ourselves, to take care of our children, and to see our future being bright. So please ensure that we check our breast. If there's any deviation from normal, please always make sure that you report to your healthcare provider. It is better to notice something and you get to the hospital and say there is no problem than for you to stay at home and there's a problem and it escalates. That's what I tell my antenatal mothers. So thank you so much for being with me on this channel. being with me on this episode. I'd love for you to drop your comments. Let me know what you feel about breast cancer. Let's know if you have anyone with breast cancer and how well the person is coping. We wish the person safety, because we have a lot of cancer survivors and we know that they too will survive. Our heart goes out to those who has lost a loved one on the account of breast cancer. So till I see you in my next episode, please like, share, and subscribe. I'm open to collaborations, advert placement, sponsorship, and I'm also open to being watching with other healthcare professionals to bring about excellent healthcare delivery. So till I see you in my next video, it's bye for now.